More children are being born with HIV across Africa, especially East Africa, because of the USAID cuts, which have left many pregnant women without access to the life-saving treatments they need.
We went down from about 30% transmission to 3% transmission, right? So that's all being done, but we still have those 3%, and we still know that people get positive during pregnancy, and then you have a HIV vertical transmission that happens.
And that is just one part of the crisis. Across the region, clinics are shutting down and patients are having to skip their life-saving medications, which means they can build up drug resistance.
On the ground, they need medication. Many of them, they have 3 months now or 4 months, they haven't taken medication. We don't know what's going to happen. They are defaulting.
So who's to blame? Is it the Trump administration's aid freeze, or are there more systemic failures at play?
US funding previously made up just over a quarter of Kenya's official development money, and from what we hear, everything from education to the National Health Database could be affected. Most worrying, though, is the upkeep of life-saving measures like medication for the 1.4 million people in Kenya living with HIV. UNAID says there's enough medication for the next 3 to 6 months, but after that, the situation isn't clear.
HIV experts are concerned about the impact on vulnerable groups, such as the people that used to attend this clinic. Now, clinics like these have been set up by NGOs and universities, specifically focusing on communities like sex workers and members of the LGBTQI+ community.
Let's follow the money. Welcome to the flip side. Now, 8 months ago, US President Donald Trump froze nearly all USAID programs across Africa, including those supporting sexual and reproductive health clinics.
Life, people support me, the world support us, and now suddenly with this and how it happened, I think we're a bit in shock.
In South Africa, which does have the continent's strongest public healthcare system, medical professionals are feeling the pinch.
Any health services that they use to access it have worsened the situation.
The funding we got from USAID, just in South Africa, we lost about 8,000 frontline healthcare workers. And those workers that's being in the clinics at the front face of it.
So, what happens when people cannot access decent sexual health services like that?
All the NGOs clinic that they have been assisting marginalized, they totally shut down. HIV and AIDS will be spreading like water.
We're being killed in this manner. We're going to die. You know, the day I heard that funding had stopped, I felt like I was dying. Transport is a big issue in this area, and we don't get regular visits from the mobile clinic. If you're going to rely on a mobile clinic, you often miss it because the schedule is unreliable.
And it's not just about STIs. According to the WHO, around 800 women die each day around the world from preventable childbirth and pregnancy-related complications.
The face for HIV in South Africa is women, because 65% of women are HIV positive.
So a freeze on reproductive health funds is only going to make this worse.
Where we look at health, the world will be healthier. Where there's health, there will be peace. Where there is health, and when we look at health, it will help with human rights.
I understand that sexual health is personal, but public health should be everybody's business. So we obviously need these aid funds to keep people healthy and working, to keep entire economies around the world going, economies that are interwoven and dependent upon each other. So what's the way forward?
We need to solve the problem at the clinic. It's between me and the patient, it's me and the community.
Dear Mr. Trump, if you can return the funds that can assist and save lives, you'll be a better president.
And that's the flip side.